But some idea, you share and commotion as it near share commotion as here. Now, you Dr. Florence K, Akumiah, and you AD and Common, a medical doctor affiliated to the National Cardiovascular Center, currently at internal medicine specialist training at the Kolebu Hospital with interest in cardiology and preventive medicine, or a vice president of the Ghana Association of Doctors in Residency. And she's passionate about health education and advocacy, as well as capacity building as progressive, drivers of disease prevention and health promotion and preservation. And I pay one menino AD and Komo Abra, ye din Komo FA World Health Day. Ya pomodin and Komo. Doc, good morning.
Good morning.
Nah, no pain to say.
By God's grace, I'm doing well.
Bofuni de be
Oh, you be catchy kakra.
You be catchy kakra. Do you have the bofuni shia me na say or say me boba mo. Na ene eye World Health Day no. Adokota for dem ni say by this time aboabo mo ho ene de mo be ene bibia. But mimbi say significance of World Health Day no. Ewo mo profession no any day.
Okay, so ne question say over the years no ye gather data, ye gather statistics near who yareko a was so nipa problem yare nipa bebre suffer from, okay. And see sad data no yet me say nipa bebre wu from yare way and as yare way into say ye bibi etimi esi sad kredena no into na World Health Day no say ye who sa information we no. How do we let the public know? Because health no is even though it's a global problem, individuals can help us to control health, diseases. And see if we disseminate the information to the population now, then they also know what they can do to help to preserve their own health.
It's interesting the theme for this year, almost say our planet, our health. I'm trying to sync the planet and our health.
Okay, so earlier on you mentioned the issue of global warming. You talked about pollution, and these are things that affect our environment. And human beings do not exist in isolation. We live in the environment. So if things pollute the environment, that means that those things will eventually affect us. You may think that it doesn't directly affect you. Somebody is mining somewhere and it's not in your neighborhood. But then the water runs through to join the main pool of water, and eventually your drinking water is contaminated. People are using fertilizers that are not approved, and you're going to buy that produce in the market not knowing this. So it's our planet. We need to work together to keep it in a state that it will not be the source of our problems or our diseases.
Interesting. Now, you didn't come on and our Ghana Hanum say you hear cases of increase in cardiovascular diseases, increase in cases to do with amount for kidney, any or more organs, any hormones and some. But I want us to focus attention on cardiovascular diseases. Okay. Your cardiovascular diseases are diseases.
Okay, so diseases affect heart no Akumiah no any intini na edimoje di afrosane no. So intini no edimoje di afrosane ko baby bebre organs bebre inti say sa intini nya problem and also so into diseases of the heart and the vessels no.
How prevalent are these diseases presently in system?
So they are quite prevalent, and if you look at the global statistics, when you look at deaths, it caused about 18.6 million deaths globally in the whole world. And when you talk about the leading causes of death, you have cardiovascular disease being the leading cause, followed by cancers. And you look at the disparity between the two. Cardiovascular disease is leading cancers by about 8 million. So you can see that the burden of cardiovascular disease is very high. And it's not just high in the world, because oftentimes when you're doing say we have to understand that it's coming home to us, because statistics shows that more than 75% of the deaths are occurring in low and middle income countries. And Ghana, sub-Saharan Africa, we are, we meet that. We are in that category, so we should know that the prevalence is high locally too.
So we say cardiovascular diseases, which means that they can be itemized.
Yes. Okay, so they include stroke because it's from a vascular source, a vessel. They include heart attacks. They include heart failure.
Okay.
The heart itself can have abnormalities with its size and its structure that causes heart failure, or what we call cardiomyopathies. And sometimes the heart can beat with an abnormal rhythm, arrhythmias. So all these things come into cardiovascular diseases. So some kidney diseases are even caused from vascular sources or causes, so they can fall into that category too.
Interesting. Now, you're trying to understand the desire about onipadasini. What are the causes?
Okay, so yeah, when you're friend of risk factors also, so risk factors of cardiovascular diseases. And we try to group them into those we can do something about, those are modifiable, and those that we really can't do anything about, those are non-modifiable. So those that we can't do anything about include things like your age, because cardiovascular disease are found to be increasing when you're growing older. Okay, and your gender. So before the menopausal age, before a if you compare, it's commoner in men. But after menopause, it tends to be commoner in women. Okay, so that's because estrogen tends to protect you a bit from cardiovascular diseases. And then if you have a family history, say, 45 years, 50 years, then heart attack, stroke, it means that you have a high risk factor for cardiovascular diseases. So all those things are things that you really can't change or you can't do about anything about. For instance, if you yourself have even had a stroke or a heart attack before, you can't change the fact that you've had it before. That just means that you're at a higher risk than someone who hasn't ever had that. Okay. But what we focus on is the things that we can actually change. And there are main things that we have identified called traditional modifiable risk factors. This include having high cholesterol, your blood cholesterol being high. It also includes having hypertension, diabetes, what we call smoking, tobacco smoking or cigarette smoking, and alcohol use, excessive alcohol use. And then when you are very obese, and then when you don't exercise, so sedentary lifestyle. So all these things are risk factors. You could have just one, but it's still a significant risk factor. But it's worse when you have multiple of them at play. And the interesting thing is that usually when you get one, your risk of getting the other is high. So then you tend to have a constellation of them in one person.
Interesting. So at the early stages of these group of diseases we are talking about, obviously the body will give you signals that there's the possibility of this happening tomorrow.
Okay.
Or it wouldn't.
So typically, no. So these risk factors, especially for hypertension, you could have it for a number of years and not really know. And that's why we advocate that people should be checking their blood pressure often. You should know your numbers so that if you check it often, the moment it starts becoming high, meeting the criteria of hypertension, you identify it and you treat early. So the mainstay is prevention, okay? Because you may not be able to tell when it starts. Same with diabetes. People can have it for years, and then especially type 2 diabetes, you have it for years before you detect it when it's causing complications. Okay, so oftentimes you don't know that you have them unless you are actively checking. But things like obesity and weight gain, you can tell. If you are not physically active, you can tell. So those ones you are glaring and you need to do something about it.
So the body won't give you any signal that it's giving you some migraine, it's giving you some headache, it's giving you some heart palpitation, it's giving you some this. It won't give you any signal at all?
Yes, so like I said, those are when it is causing complications.
Okay.
Yeah, so some people, when the blood pressure is very high, some people tend to experience things like headaches. Some people can actually have brief moments of blackouts or weakness, which we call transient ischemic attacks. But that's not the beginning of hypertension. That happens later when it has caused changes in your blood vessels, so blood can flow through them well. Yes.
So you mentioned a couple of things, and I see that lifestyle is key amongst them. So I'm here. I got here, let's say I woke up around 4:30. I'm here by 5. Show starts at 5:30. I'm here till 2. I'm in the office. The next moment I'm driving to the house. I don't have time to exercise. Are we all virtually at risk? You are a medical doctor.
Yeah.
You get to the office maybe by 6. You are going to drive from the house 6 to, let's say, 8. You drove. and then throughout the period, you are sitting down, attending to your patients who are coming in. You go for your break around, let's say 1, 2 thereabouts. You are back in the seat again. Are we all not at risk with our lifestyles we have now?
Exactly. So that's what we have to emphasize on. So over the past few years, you'd realize there's been a movement for increased physical activity. So you find that you tend to find people jogging, the Ebri mountain climb, the pediatric climb. People are doing that because it takes conscious effort to be able to incorporate physical activity into your life. So for instance, for market women like this, they are also very sedentary, and they may not realize that I need to actually do something about it. And you may not have the time to do something about it in your daily activity. So you have to find ways of incorporating it. So probably like if you would take a cab from one junction to another, you could decide that I would walk instead. Okay? So that it's still taking me where I need to be, but I'm having the benefits of a physical activity. You need to do about 150 minutes of physical activity in a week. So you could do about 45 minutes 5 times a week, and it could help you get that. It should be like moderate intensity. So brisk walking, you could skip, you could dance, you know, physical activity that gets the heart pumping. But the thing is that you need to do it consistently and not just once in a while. So you should find a way you can incorporate it into your life, or you should intentionally set time aside for it. Now,
at the center of all this is the heart. How do we keep the heart healthy?
Okay, so it's by managing all these risk factors or preventing these risk factors. So if you are young, you have gone for your general health check, and they tell you you have a clean bill of health. What you should do is prevent hypertension, prevent diabetes, prevent high cholesterol. Okay, and you do that with the lifestyle that we've talked about. So you check your diet, and then you have exercise. If you smoke, you're advised to stop. Yeah, because smoking is a very strong cardiovascular risk factor. If you drink alcohol, we recommend moderation. Sometimes it's hard for somebody to abstain completely, but moderation. Okay, you shouldn't drink more than 14 units in a week, which is maybe if you take a shot, more than 14 in the whole week. You shouldn't drink more than that. The less, the better. Okay. So these are things that you can do. But once we have detected that you have hypertension, you should ensure that you are treated for the hypertension. Like I said, you may be sitting down feeling fine and knowing you have hypertension, but thinking because you feel fine, there are no consequences of it. But it's silently causing a problem. So what you need to do is control it with medications so that it doesn't cause that problem. People have a problem taking medications for sicknesses that aren't very overt. They are not seeing any sign. But that's one thing we need to hammer down. If you have been told that you are hypertensive, you should know that without the medications, you are likely to get complications. Even with the medications, there's still a chance. So why take the risk? So you should take your medication. Same for diabetes. Same for if your cholesterol has been detected to be so high that your lifestyle alone is not bringing it down. Sometimes we give you medications for that. You should take the medications for that.
It's a problem. Diet. So I sit here, I drink tea. My lunch, maybe I'll go for something heavy. Maybe some fufu or some banku or kinky. I get home, maybe some tea, and then I sleep. What constitutes good dieting? Good eating?
Okay, so it's both the quantity and the quality. Okay, so with the quantity, you tend that us, we tend to have a high carbohydrate based diet because the carb forms the main part of the meal. If it's banku, it's 2 balls of banku with a little pepper and fish.
No, mine is 1. Mine is
one or two, but the regular Ghanaian will go to you see pictures of the chop bar, and they either fufu with a lot of meat. Sometimes you really don't need all of that. Maybe back in the day when they used to go to the farm, weed the whole day, they were exerting a lot of energy, so they need to replace. It's a balance. How much you do should be replaced. If you maintain that balance, then you are not gaining weight or losing weight, if that is your target. So what constitutes a healthy diet is you take moderate carbohydrate intake, moderate protein, the fats to just a little bit of fats and oils, preferably if you use nuts. Nuts have some oils and healthy fats in them. So groundnuts, cashew nuts, they may be good for you. Then you should have a lot more vegetables and fruits. The WHO advises that you have 5 portions of vegetables and fruit. A portion doesn't necessarily mean like banana, then go and eat a whole bunch of banana. It could be a finger of banana. It could be a slice of half of an apple and all that, yes.
So in the mornings, I know you explained that per the work you do, the diets will be different. If somebody is going to do hard labor work this morning, his diet will be different from mine, who is coming to sit here and talk. Because
so it may be a perception that he needs that much. That he feels like, I'm going to work a lot, so I eat 3 balls of banku because I'm going to be sweating. It's not really that. Your body needs 1 ball could be enough. Okay. You may need more carbohydrates because that's an energy-giving food, so you are using more energy, yes, as compared to somebody who is going to be sedentary the whole day. But it doesn't mean it should be in excess.
Now, how many times must one visit the hospital for these regular checks?
At least in the least once a year.
Once a year?
In the least.
And what am I going to look for?
Okay, so when you go for a routine, we actually have some wellness clinics around. I think some polyclinics also run wellness clinics where you go for a routine check, because I think one deterrent is people going to sit in a queue with people who are obviously ill to do a routine check. People find it to be irrelevant. Okay, so you go to a wellness clinic, they're going to do a physical examination. They're going to check if you already have signs of diseases like hypertension. They'll check your blood pressure. They may do some routine labs, including your blood glucose test. They'll check your kidney function. Sometimes they check your liver function. They may, if you have hypertension, they may check your urine to see if it's affecting your kidney already and all that. They'll check your weight and assess your BMI. Then they can advise you on what you need to do based on your BMI. So those are things, basic things that they do.
So one other aspect of the conversation is a resort to herbal. The herbal cures everything and anything, from what we hear in the trotros, in the buses to intercity buses, at the market center where Koko Sasabro, every disease there's a cure, and people attest to the fact that they are working. Does herbal really play a part in the upscale of the frequency of these, diseases we are talking about?
Well, okay, so first and foremost, people have the misconception that doctors are against herbal medications. So before, people are already prejudiced against anything doctors have to say about herbal medications. What we see in the hospital is that we cannot outrightly say that herbal medications are bad. Some of them are good. The problem is the scientific studies that are done on them for us to know the safety and efficacy. Because even with orthodox medications, there's a particular dose that is safe, beyond which it is unsafe and can have complications. And because we know it, we're able to give the dose that is safe for you. But oftentimes, for those who just package things and sell in the trotro and the rest, that is not known. We have a plant and research center where they do studies into these. And we have herbal medicine doctors who have gone through university training at the KNUST. If they have approved medications that have been studied and found to work at a particular dose, we are fine with that. But when you buy things from the church or you just go to the farm and pluck things, boil, soak it in alcohol and drink, they can have effects on your kidneys, they can have effects on your liver. Now, when you get chronic kidney disease, that's another thing that has been had an upsurge in the past few years. A lot of people requiring dialysis and all that, even young people. When you get chronic kidney disease, that in itself is a risk factor for cardiovascular disease. So I cannot recommend that you just go in for any herbal medication and take. You should know what you're taking and why you are taking it. It should be recommended by someone who is qualified to make that recommendation to you.
So these herbal medicines, people are taking them. People say they are good. and it's having adverse effects on them, it's brought to the hospital, and before you realize it's too late. Okay, this is not a conversation for you and I. It's a conversation for me and another person. Let me drop it there. But let's talk about stroke, for instance, and the number of cases we hear of young people who are getting stroke here and there. What is causing this, and what's the prevalent rate, if you do have some idea in terms of the statistics?
Okay, one cardiovascular risk factor I didn't talk about is psychosocial stress, because you realize that the environment and the economy has effects on you psychologically. So we've also found that there's a higher prevalence of stress, anxiety, depression in the general population, more so in the young population. And also studies have done, there's a study that was published in 2018 in a tertiary, assessing cardiovascular risk factors in a tertiary institution in Ghana. And they found that there was a significantly high prevalence of all these risk factors that I've spoken about in young people. There's this misconception that if you are young, you are healthy. So young people usually do not pursue health checks. And so we are not detecting the problems they have and treating them for it. So that is why they are having silent hypertension, silent diabetes, silent high cholesterol. They're engaging in risky lifestyle like excessive alcohol use, tobacco smoking, and they're getting cardiovascular diseases.
So
they're getting strokes.
If I get you right, our state of mind can contribute to these cardiovascular diseases we are talking about?
Chronic stress has been found to be a major risk factor for cardiovascular diseases too.
What do you mean when you say chronic stress?
So it's okay to for a day maybe be stressed about a deadline you're having to meet. But if you're like you're living hand to mouth, you are in a state of poverty, you are always worrying about how you're going to get your next meal, that then becomes a chronic state of stress. Every day, what we call hustle. Every day you are hustling. Yeah, you can then be chronically stressed, and that is a risk factor. But it's different from just a single day. I've experienced stress for a single day. But when it becomes a constant in your life, then yeah. And it's likely to be a constant in your life. Even I sometimes talk about the traffic situation in Accra. You are in it for long. You are getting angry at other drivers. You are worried about not meeting your deadline or wherever you are going, being punctual and all that. So most people in the country may be going through chronic stress, and we don't really talk about it.
So economic hardships can lead to people having these diseases?
Yes, definitely. Right? That's why one of my opening sentences was that more than 75% of the deaths from cardiovascular disease occur in low and middle income countries, and all these things feed into it.
So worldwide, with concerns about hardships all over, Ukraine war and petroleum fuel prices going up, prices of goods and services going up, you're telling me there's a possibility we may have an increase in the number of these cases that come to your offices?
Yes. And the thing is that these things tend to be slow and what we call gradual and insidious. So you may not see them this year, but in next year, a couple of years down the line, you may have. But definitely, the cardiovascular diseases trend is seeming to rise all the time. Yeah.
Well, if you just join us, you are welcome to the conversation. We are talking about cardiovascular diseases. Today is World Health Day, and we're trying to have an appreciation of what we must concern ourselves about. There are other areas I would want for us to touch on, in as much as they all contribute to cardiovascular diseases, because we're talking about our planet and our health. So the air we breathe, emissions control and all, and the fact that we are told that, look, if we don't cut down on the emissions from our vehicles, from our refrigerators, from our air conditions and all of that, we may be endangering ourselves or putting ourselves in danger. In that respect, are we in danger? Most of us are mostly in our ACs most of us mostly are walking about in areas that, you know, we know.
Okay, so respiratory diseases are the third leading cause of death from the WHO statistics. So they are very significant. And I did a rotation in pathology where they do the autopsies. And we had to do an autopsy for a young baby. And the lungs were clean. They looked so pink and beautiful. Then we did, that was a baby. Then we did for an adult, about 2 or 3 adults. And they all had these black things around the lungs. That's not what killed them though. But that's just to show that the air you breathe is not as clean as you think it is. It contains toxins, especially if you sit in traffic to come to work. You think that you are in your AC, but then there's a vent that circulates the air from your car to the air outside. So you are exposed. That's why it's our planet, our health. You cannot be isolated from these problems. So yes, so far as you're breathing air, you are at risk.
You think we are taking issues to do with our planet? Let's not look at the world, but Ghana for that matter. From a health personnel's perspective, we are taking issues to do with our environment seriously.
I think there's much room for improvement. I think some things are being done, but there's still much room for improvement, especially in the health sector. There's a lot of room for improvement.
We will be rounding up our conversation shortly. We would activate the phone lines briefly for people to call, and if they have questions, they would ask them. If they have comments they want to make too, they would. But what would be your advice to everybody who is following the conversation this morning?
So I'm going to hammer on prevention, okay, and lifestyle. Lifestyle being used as prevention. So you've heard all that we've had to say. You should be responsible for your health, and you should endeavor to go for your health checks. You should endeavor to take any treatment that the doctor recommends for you or prescribes for you. And you should intentionally check your diet, ensure that you're physically active, stop smoking, drink just a little alcohol as occasionally if you can, and try your best to live a healthy life.
Someone just sent me a text and wants to find out. Sami, please ask your guests whether heart attacks give warnings before they happen.
Yes. So heart attacks may give warnings. There are some people who realize that when they exercise or they exert themselves, maybe they are climbing steps or they are running, they are walking up a hill, then they have chest pain. And when they stop that exercise, after a few minutes, the chest pain stops. That's a warning sign that you may have a blockade in the blood vessels leading to your heart. So you should get it checked. If you do not get it checked, it can progressively worsen till the blockade completely blocks enough of the tube so that blood is not really getting there. Or one day that blockade will burst and then a clot will form on it and now close it off. Then you get a heart attack.
Now, what you just mentioned brings to mind a case I was handling. People are afraid of surgeries. And so just the fear of being told that, oh, there's a small growth, there's a small blockade in your vein or in your arteries or something, and may require a surgery. That alone, the person won't come to the hospital. Do you have such cases?
Yes, we do have such cases. So the thing is that due to technology, surgery is not the only way out now. Based on how severe the disease is or what we find, we may go in to do what we call a coronary angiogram. With that one, we are just going through a vessel, maybe through at your wrist or at your groin. Then we go through the vessel to the heart, the vessels of the heart. We inject a dye. It outlines the vessels of the heart. Then we're able to tell if there's a blockade, where it is, and how much blockade it is causing to blood flow. Then during that same process, we can actually put in what we call a stent. So it's like a wire mesh that opens and pushes the blockade to the side so that blood can flow well. That's like a surgical procedure, but it's not open surgery. It is one of the minimally invasive procedures that we have that can be done for you. But in the least, if you do not even want surgery, we have medications that can help to relax the blood vessels so that blood can flow better, so that you don't get a heart attack. Maybe in the process of you contemplating, thinking about it. And then we have a lot of success stories you can look at. A lot of people coming day in and day out for the procedure, and they go home. Usually, if you have that procedure, in a matter of 2 days, you're going home.
Is it normal? Would you classify some one-off pain in your chest as a cause for concern for anybody?
Not necessarily. So for chest pain, there are so many things that can cause chest pain. So oftentimes, how the pain is what helps you to know whether it's from the heart, or it's from the lungs, it's from the bone, it's from the muscle, or whatever else it could be. So for the heart pain, we call it angina, okay? It's a pain that is usually, it may be central, it may be to the left, and it is a crushing pain, as if something has been placed on your chest, or a tightening sensation, like someone has wrapped a belt around you and they're pulling it tight. Typically, that's what it feels like. And sometimes it can spread. So that pain is going to your neck, is going to your arm, and this pain would last for the duration of your exercise. And after that, if it is a stable angina, within a few minutes, less than 30 minutes, to stop if you stop the exercise. There are some medications too that we give. So if you use the medication and you spray it under your tongue and then the pain stops, it lets us know that this pain is likely to be from the heart. But other pains, like sometimes in elderly people, in women, in people who have diabetes, they may not get this typical pain. They may just have a burning sensation like you get if you have an ulcer or reflux. They may have just a burning situation, but if you go to the hospital, the doctor looks at you as a whole, listens to you, examines you, and makes an impression about what the cause could be.
A friend says for me to ask you, how about those who sometimes have a problem with breathing?
So it depends. Heart diseases can cause problems with breathing. And because the blood pumps from the lungs to the heart, and the heart will now pump it around the body. So if the heart has a problem, sometimes it can affect your breathing too, especially in the case of heart failure. And if you are not pumping enough blood around your body, then your tissues feel like they're not getting enough oxygen, because the blood is what has the oxygen. So you may want to be breathing fast to compensate, to have more oxygen in the blood, so that whichever amount gets to the organs, they get some significant oxygen. So yes, you can have difficulty in breathing. You can get tired easily when you have heart problems.
Another one, me, I'm mentioning it, so don't come and hassle me after the show. Your budidi.
Okay, yeah.
Your budidi. Should you be concerned about your budidi? Maybe one club will be a.
Okay, so the thing is that, like I said, we have a limit for the week that you wouldn't want to go beyond. So imagine if you are taking 2 thoughts at every meal. Maybe morning you didn't take, but lunch
kind of thought.
Beer.
Club,
okay,
beer.
So I talk about thoughts because that's really equates to a unit.
Okay.
But for the beer, it depends on the size of the bottle you drink. Yeah. Okay. So maybe if you have beer, 2 bottles of beer could be equivalent to 2 thoughts. Okay. So if you're taking beer at every meal time, you're taking maybe lunch and supper. And at the end of the week, maybe weekends, you also go and sit out with your friends. You take about 4 bottles of beer. You're most likely going to exceed the limit. Okay, so I don't know where it came from, but you tend to have a lot of people thinking they need to have some alcohol before they drink, but it shouldn't be a routine thing that you do, especially if it causes you to drink to exceed the allowable limits.
Obviously, Mbisa said, Okodano Chebia, or Dayipa, and should he be concerned?
Well, it's all about how much he takes. You know, I mean, that's why I didn't say you have to stop drinking alcohol altogether. It's all about how much you take. It is the kakrebi na wonom, once in a while to be able to have a good night's sleep, fair enough. But there are other ways you could get a good night's sleep. So why not pursue that if those ways are not going to affect your health in any way?
Those ways, no,
it depends on why he is unable to sleep.
Okay.
Yeah. It depends. Like I said, even it could be psychological stress, which needs to be addressed. You need some, psychotherapy, maybe cognitive behavioral therapy. You get someone to talk to and identify what the problem is, and then you could sleep better.
I know it may not be your field, but this whole therapy thing we are talking about, as a society, there's some sort of stigma. Oh, and I'll call a class psychiatric about, and I'm saying and all of that. Meanwhile, it is one of the causes of this cardiovascular disease.
So, well, we need to address that stigma, and I think I have colleagues who are in the psychiatric department, and they've been doing a lot of advocacy and education about it.
Okay.
We are way past the time where psychological diseases should be seen as, in the past, if you have a family history of it, they won't allow you to marry into that family. But there's treatment.
Okay.
So if somebody has a problem, it's like having hypertension. You need treatment, you get treatment. If somebody has depression that needs medication or needs counseling, they should get that too. And people should be confident enough to. The more people own up to it, the more people stop stigmatizing it. Eventually.
My final question, I will mention your name. I want to do John Kumba, my director of the show. My director wants to know whether frequent sexual activity, can lead to any of these cardiovascular.
No. No. So actually, sexual activity is a form of physical exercise, so it shouldn't lead to it unless you already have a heart problem where overexertion may be detrimental to it, may set off your heart beating too fast or something. I know some people have sex and have heart attacks. I've had a few patients who had it right after a bout of sex. So some people have even cardiac arrest and die. You've heard of people who died in the bed. Yes. So if you've done your routine check, your heart is fine, you can have your sex.
John, I see problem be anyhow. We are bibiamba until the cosina yejuma. So you're so yejuma.
The echocardiograph is done to assess your heart, its function, how it's able to pump. So what he's talking about is the ejection fraction, and it describes how the heart is pumping blood from the left ventricle to the body. And we have certain dimensions that we give to be able to see how well it is. EF of 67 is fine, actually. So if it's less than 35, we say it's reduced. Anything more than that now is termed preserved. But even with the preserved, we have two groups. We have mildly reduced, and then we have normal. So those are the ways we would describe it. But whatever the case is, when you've done an echo, you should show it to the doctor who requested it. If they need you to see a cardiologist, they'll let you see a cardiologist, and then they'll talk about it.
So he was also asking about...
Well, cardiac arrest.
Yes.
Yeah, so a cardiac arrest is, it just means your heart has stopped pumping. Your heart is not pumping. So when you have a cardiac arrest, you won't be breathing, you won't be conscious, and you won't have a pulse. And it can be caused by many things. It could be caused by cold, excessive cold. It could be caused by what we call electrolyte abnormality. We have potassium. The potassium is too high or too low. It could be caused by fluid around your heart that has accumulated so much that is preventing the heart from pumping well. Could be caused by so many things. But the end point is that now at that time your heart has stopped pumping, you don't have a pulse, and you're unconscious and you're not breathing. So that is an emergency. And what we recommend is that you would require cardiopulmonary resuscitation. So that's when you would require chest compressions, and then people are pumping, either breathing into your mouth or pumping air with a bag into your mouth.
All right. 0244-885140 0549-508687 with me a friend so question be up so be sat doka and I say or a comment via was on here Akumiah honum offer 0244-885140 and 0549-508687 with me a friend now also so on your dinkumo earlier now my some data about the cases are ebamo honum the youth cohort no womo omunya yare no at the same I'm say call be was but my me ba hello good morning
Sabi
yes,
I want to say
Bacho mo ya
yeah in fact questions ni na or question ba ko bi ya me de na madam susu yi ano ma atoma ko aso papa Sabi question obu say to say sense it's a question now obo ni pani bi obu say na say sense to let ma onya heart attack ni that question no atoma ko aso pa Sabi in fact ama onu si yi ano say I to say exercise ability about protect grandma maybe which mean heart attack no that question at my come so what you in fact I never want to say and my happy friend you be me here you that's papa that question no busana madam here no my
na try answer no akọ the year honey year de no honey year de na say wo bo adwuma
me bo adwuma if you say cry me close 50 na ma ware 21 years girl and I'm Mr. Pastor one ba ko count I want to mark that question here the papa
suspect for the humu nyina
yeah it me that's pa
and it the one body ni ba me me pa me ne kasa
that question
me do ask on the pay so for me now about video no eso and back to the question I was asking about the youth population no susceptibility to cardiovascular disease net saying in terms of cases that are reported to your outfits.
So before I answer your question, let me speak to what he just said because I don't want to be misquoted.
Okay.
So I did say that it is an exercise and may be protected, but if you already have an underlying heart disease, then it could predispose you to, tipping over. So his age, he would need to be checked to be sure that he doesn't have an underlying heart condition.
50 years.
Is that? I thought I had 60.
Oh, okay.
Okay, so it depends. But I mean, ideally, everybody should get checked anyways. Okay, great.
But 50 now also slow down.
Oh no! I'm not talking about slowing down. The problem is only underlying heart disease. I'm not going to tell you say you need to limit it. No, but if you have an underlying heart disease that can be worsened by overexertion, then you need to have your doctor advise you as to how to proceed.
Okay. I'm going to call Abina member back to the studio. Hello, good morning. Yes, sir, Chief.
The same is doctor on. The problem is sometimes she complains that Akumiah no, how will I put it? She can be breathing.
Oh, Opani wa homa no emunti papa. Hello? Yeah, but your own position when you the reception is very bad. Hello? Oh, I'm Sahomano.
So now to answer your question that you asked about the proportion of young people who are coming. So just by observation, I don't have hard data, but even with stroke, we found that younger people are coming in with a lot of stroke. A lot of people are also coming in with chronic kidney disease, which I said earlier on is a cardiovascular risk factor. And even with heart attacks too, the ages are coming down as so opposed to maybe about 20 years ago. Yes.
We will try and have an understanding of how that is the case. But you're fine, next caller. Hello, good morning.
Morning.
Yes, sir, Chief. Morning.
Yeah, hello.
Yes, I'm a tune. Come back to the baby for free.
Pacho, your friend was able to Simano.
Yo, in my uncle.
Pacho, let me tell you, this is very big asphyxia. Oh. No.
What do you want, Pacho?
Asphyxia. Difficulty in breathing. As a woman. Na tell you, and the cardiac arrest in banana.
Okay. But what
yes,
it?
so when you asphyxia is something that blocks your breathing. Okay, so you're unable to breathe. So when you're unable to breathe, your oxygen levels goes low, so it can cause a cardiac arrest.
Okay, all right. But folks, Mama, we are not doing diagnosis here. Let's get that, because I don't want us to put her in a position where she's in here and she's diagnosing people's problems. No, it's unethical. But let's speak to the general concerns we may have. She may try to explain certain things to you as per the general conversation about cardiovascular diseases, but let's not treat specifics. That's why you have a doctor. And so, wako doctor show, you have a right. The patient's charter gives you the right to ask any question whatsoever of your doctor. And the main free hospital MP now timu enguswa enyo na wabewa mbisa doctor and say we are trained or how much in the say you have a right to ask that question. And the Oko hospital, don't just go and say the doctor besides Nana, also here for Osi or Hanum say, Nana or the Osi say, oh, we are not KBBI, you have a right to ask questions about whatever prescriptions that the doctor is giving you. Or try to draw required the and doc, we are better you have that right to ask. And the Mamma me and Yeno diagnosis ya or Hanum say, Mr. Mupi. I hope that's
fine,
right.
Yes.
And the Mapamcho, you better a few more calls, if there are any, and then we'll summarize this morning with our conversation. But I would urge you, sir, oh, from your basuni, not one. Oh, sure, what did you exercise is very important. Yes, sleep, amount for sleep patterns, and then very terrible. Obi on ma, Obabi do fear, and you may 11 p.m. By 3, or sorry, I will quit you, ABM. When you bounce on complications, people, a lot of good sleep also helps you to have a healthy lifestyle. But I was trying to understand why the age group that previously would not have these things are suddenly having them.
I wouldn't say it's a sudden. So there's been a lot of urbanization. So our dietary patterns have changed, and even mechanization. We are using more vehicles than walking like it was in the past. So all these are feeding into it. Like I said earlier too, stress. Younger children are even being found to have stress. You can see kindergarten people who have to go for extra classes. So you would wonder whether it's not eventually going to have an impact on their health. So,
next caller, I want to say hello. Good morning.
Hello. Good morning.
Good morning.
So, person, Mr. Doctor say, I have the cheek. Oh, my common cheek, the left side. I tire me up and the neck, the same side. I tire me up.
What come at cheek?
I said, me breast itchy.
Breast the cheek. Okay. All right. You. But my two question.
And at times me care to miscomfort. Then this is well, because on China I'm quite easy, say everything is fine, but I keep on experiencing it. It's almost not to something any soluble aspirin, so but I keep on having it. It's not me to say be something I say who specialist and I said this. Thank you very much. God bless you.
All right. Me do say no place of it, Doc.
Yeah, so it's very hard for me to tell exactly if the problem is from the heart just by the things she said. But medication is normally a man no. It's as if to assume they think the problem is from the vessels of the heart. So if she's still experiencing it, she should go back to the doctor and let them know that she's still experiencing it, because they need to confirm if there's a problem with the vessels, and then if she needs anything procedure to help open them up. Otherwise, they need to look at other possible causes of it, because it may not be that.
All right. Yeah, before your last two callers, and then we'll wrap up for this morning live on the Happy Morning Show. NT 0244885140 and 0549508687 between our femina or question or comments via or the Abraham. But Doc, you're starting commodity, you know. Then people are calling, and you can see that they have problems. Now, these problems, you would expect, say, they would have gone to the hospital for the doctors to check. There are several people who have not called us, but may have signs, symptoms, and all, and yet have not been to the hospital. Self-medication, from why do people find it difficult coming to the hospitals with symptoms that require attention and yet they wouldn't come? But before you answer that, hello, good morning. Good morning. Well, I'm saying no share no TV so, but do you as health professionals try to have an understanding why, for instance, we'll be on now, we walk to hospital, your man in raw offer, but Philippines behind the breast. The obvious thinking would be that I'll go back to the doctor and say, I'm a drone, but I'm still feeling this. But until yet. Do you try to find out why people don't come?
Oh yeah, if we, well, generally there's a health-seeking behavior amongst Ghanaians, from my observation, is very poor. Because I mean, before I'm a doctor, I'm a Ghanaian, and I have family, I have friends, and I know that a lot of people experience symptoms and delay in going to the hospital. And this is one of the reasons why oftentimes we diagnose things late when we can't really do anything about it, and then all we can do is help to make you comfortable. So the recommendation or the advice I would give everybody is that if you're having any form of symptom, you should go to the hospital. Another challenge is that people want to go to the tertiary hospital from the onset, and then you go there and then there are long queues, you get discouraged, you don't want to go the next time. We have different levels of hospitals. We have clinics, we have district hospitals, we have regional hospitals, so, and we have a referral system. So do not hesitate to go to your district hospital with your complaint. If the doctor sees you and feels that you need to go and see a specialist, they'll refer you to see a specialist. And if you have a problem with how you have been managed, you have the right to always seek second opinion. You don't just decide that because one doctor gave me this and it didn't work, I'm not going to go to the hospital again. I'm going to do things my own way, yes. So essentially, those are things that we need to address ourselves. Nobody else can do that for us.
Interesting, but do you think education must
health
go
education. And I think that we've been doing quite a good job. You have health personnel who come on TV, radio. There are some health personnel who have their own channels where they offer education on social media. So yes, the education needs to be, worked on. We should spread it to all the corners of the country and make sure everybody knows. But beyond the education, there's only so much we can say on a TV show. So if you go for your annual health checks, you can ask any question you want to ask, and then you'll also be assessed.
Yeah, Kasana, then I mentioned patient charter. You think that patients anymore, right?
Almost every hospital I've worked in has the patient charter written. So they should know their rights. And I think you can also help them know their rights. But the only problem I'll have is even though they have rights, they also have responsibilities.
Indeed.
And health personnel should not be made to look like tyrants or, bad people when it comes to their health, because we are working together for their health. So they have their rights and they have their responsibilities too. Yeah.